CRMG Orthopedic and Surgical Specialist Clinic is a multi-specialty surgical department. We have orthopedics, plastic surgery, general surgery, pain management, the weight loss clinic, and physical and occupational therapy.
One of the reasons that I like this practice better is it brings all the care of the patient to one facility, so that we have not only a multitude of physicians and providers, but we have everything a patient needs all in one building.
And so now having all those specialists here in one facility certainly can make follow-up easier for patients, and it makes it much easier for us to collaborate.
So our clinic now, there's several things that are improved. Our location is better, I think, for patients and for me, because we're right next to the hospital.
There's the ability for us to look at each other and say, which one of us is the right person to help this patient? So I think that's hugely helpful. If we can collaborate with the physical therapists, our pain psychologists, the surgeons, then we are able to offer the best care we can.
We've added new doctors, so we can continue to collaborate with the doctors that were at our previous space, but now we've added multiple doctors. We're seeing their patients now more frequently, and so we can get back to the doctors if there's a question we have for them, or they can come see their patients while they're in therapy.
One of the best experiences I've seen being in this new location so far is there was a patient being seen by one of the orthopedic surgeons, and that orthopedic surgeon was able to communicate with a couple of other providers, other orthopedic surgeons, plastic surgeon, and the family medicine provider that we have here. And the care that was given to this patient was above anything I've ever seen in one location before.
It gets us closer to where all the sick patients in the community are, which is at the hospital.
The exam rooms are very big and have room for family members. We also have a dedicated procedure room now, which is very nice.
There's some hand surgeries like carpal tunnel and trigger fingers that we'll be able to do in the office.
The people that work here have been rewarded with a new space. The community has been rewarded with a new space. I think that's the most exciting part for me, that the medical community is advancing here.
I mean, it really does allow for better access for patients and better collaboration, and all in one setting. And I really do think that that's, at the end of the day, that's what we're here for.
This new space has worked out better than I could have imagined. It makes you realize that the decisions you make a year ago in what a new space should look like were actually what was best for the patient.